to come in. Kind of some big irony that we'll probably have like 30 or 40 AI note takers in here. And Teams is recording the meeting already. You'll get the recording afterwards. I know we get that question a lot. Oh my gosh, it might actually be 30. Wow. Yeah. All right, they just got to keep coming in, folks. Hey, good morning, good afternoon, depending on where you are in the world. Give us a minute here for people to get into the event. If you need to top off your coffee or tea, Diet Coke, or something else, now's the time before we get started. Let's give it another like 30 seconds or so, let the last people or technology get in. Folks, this is kind of a fun one in that we are going coast to coast here. With I'm in California right now, Nerev's in Minnesota, and our colleague Nicole, handling the marketing on the back end, is in New York. So truly coast to coast. Ah. Oh, and now we're gonna get the alerts of all the AI readers. Let that just zip through. All right, I think, folks, we can get started. I know some more people will be showing up as they roll in. We'll welcome them. Good morning or good afternoon. My name is Frank Jaskulke, and I'm your VP of Sales and Business Development here at Avio MedTech Consulting. I really appreciate you taking a little bit of time out of your day to join us for this discussion, our second with today's speaker. The first one was one of the better ones I've ever been a part of. It was so fun hearing many of you have thoughtful, deep, and emotional conversations. And we're going to continue that today because we know, as important as it is to know finance, to know regulatory, to know R&D, to know all of these things in medical device, it is ultimately about the people. And you as the CEO have to deal with a lot of challenges, internal and external. And I believe, and I think you do as well, or you wouldn't be here today, that if you can strengthen those capabilities, you can be a better CEO, have a more successful company. And so, really excited about what we're going to talk about today. And I'm also excited that this is a second webinar that I've got to do with my friend Narev. He does a really interesting set of things in his talks. Like, they're really fantastic webinars, but also does fantastic work with individuals and with teams. And he's going to talk a bit more about that at the end and some opportunities to continue this dialogue and engage more deeply. Last thing I'll say before turning it over is, in all of this work, we're trying to provide you with information and insights you're not getting elsewhere. If you have ideas, if you have suggestions, if there's people you think others should hear from or learn from, let me know. I really want to bring those interesting people to a wider audience and hopefully help you and help your colleagues do a bit better, because at the end of the day, the thing I care about is that we get to help more patients. So thank you again for being here today. I'm going to turn it over to our friendly speaker. Narev, off to you.
All right. Thank you so much, Frank, and welcome everybody to this very interesting discussion and talk. And we'll have questions we can hold till the end, just because we have a larger group, but I definitely want to have your questions answered towards the end. And hopefully we continue the conversation, as I mentioned, and as Frank mentioned, with an opportunity to dive further. All right, so with that, let's kick it off. I'll start sharing here. All right, so our topic today is identity shifts required for MedTech CEOs to scale. Now, again, if many of you may have attended the talk we did last year with Frank, which was focused more on founders. And so that's why this thing was intentionally focusing on the next level of leaders who need to actually scale the business ahead and further beyond the founder stage. So that's the focus. And the point here is, and again, obviously many of you know this already, but to dive deeper here, it is key to realize that scaling medtech companies demands a new version of the leader. Okay, so that's kind of the focus today. So just a quick bio background about myself. So I'm a founder, president of Stratosphere. So it's a leadership coaching and consulting firm. So I serve as the executive coach and team performance coach. I also do leadership workshops and offsites, and I also help as a business strategy consultant with strategic planning, global marketing strategies, and business growth strategies. Prior to this, I was 25 years in the MedTech industry. So I am from the MedTech industry, 25 years there. Started off in Medtronic, 23 years in Medtronic in different roles, in leadership roles at strategy and business development, marketing, program management. So I had both strategy and execution roles there. And then my last role from a corporate standpoint was at Smiths Medical as a general manager of the critical care business, which is a 380 million revenue business. So again, even though it's not a MedTech CEO role, that it's kind of a small CEO role within a bigger corporation. So in some ways, not only am I coming today to you as a coach working with MedTech CEOs and leaders, but also being in the seat of a MedTech leadership role. And of course, as a founder as well, as a founder for Stratosphere. So 380 million would count as a large MedTech company, right? And then the founders would be for the Stratosphere. So I'm coming from both ends of the spectrum from my own personal experiences, in addition to my experience coaching leaders in the space. Okay, so I have a Master of Science in Biomedical Engineering and serve on the board of multiple nonprofits, and then I also teach and practice meditation as a volunteer, as a service. If any of you want to learn about meditation, it's all free and open to all. So we're happy to share about that as well. All right, so let's dive into it. So I'm going to just start off right away. As you want to scale a MedTech corporation, which is growing and much further along from the initial founding stages, the founder tends to become the bottleneck. Okay, and so most MedTech companies actually don't stall because of the product or marketing issues. It's stalling because of the CEO not upgrading fast enough to lead with scale. And that's why the topic today is relevant and important, because over 70% of MedTech companies, which are founder-led, stall before they hit 50 million in revenue. Okay, and it's usually because the leadership at the top breaking first. And so the board, investors, advisors, all keep seeing the same constraint. The CEO is a growth limit, and over control under delegation, only waiting for real certain data. Some examples we'll dive deeper into, but are all causes of why they kill scale at Series B and beyond. So even though it's slightly provocative here, but the leader who won seed stage will not win Series C. Now, again, I don't mean the same person not doing it, but the type of leader you are at seed stage is not the type of leader you need when you're on a scale, right? So let's take an example of so you have a founder-led company. Basically, the mentality is I drive everything. No, this is what I do in my business, right? 5 to 30 people, pre-revenue to early revenue, a founder making most decisions. Speed is valued more of a structure, and success is basically using vision and hustle. And now fast forward to the type of company which is at scale, mid-sized company. So there, the model is I build the system as a leader, right? So again, the example could be 50 to 300 people, 10 million to 100 million in revenue. A leadership team is driving execution. Structure enables scale, and success is defined more by alignment and execution. So right away, you can see some of the differences there between the founder-led and mid-sized scaling example. And so in the middle, the founder, again, unless they grow and learn, adapt as needed, they become the bottleneck in getting from A to B. So for example, the complexity starts exceeding their own individual capacity. It's just too much for them to handle on their own. The decision starts slowing down because everything stops at them, waiting for the approval. Teams become misaligned. Okay, so here's another kind of example of how that works. So people think about, okay, I just need to scale skills, right? But actually, skills don't scale CEOs. Identity does. What do I mean by that? Skills help you perform, help you do stuff. Identity is about who you are. Okay, and so what happens is skills are learned and you could apply them, but the true emphasis and behavior is going to come from your identity, not your skills, especially when things start getting rough and pressure builds and all hell breaks loose. Your skills are not going to be helping you as much your identity. Okay? The real leader is going to show up when you are actually in a stressful situation. So when you have identity which is shifted, you rewire who you are and how you lead, then you're able to actually lead to scale. So it's not just about building a couple of skills, attending some workshops, and you get there. Unfortunately, it's not that easy. Skills can be copied, but identity takes some time. And that's really what's required to actually make this change to the leader you need to be for scaling your company. Okay. So the problem again is rarely skill. It's more the startup identity you have, which worked in the beginning and led you to this point here, but it's not going to be helping you get to the next level. Excuse me. So the example I can share is, you have you're on a little canoe going across a river, and then you get to that side and it's a forest there, but then you just carry the canoe on your head and keep walking because it helped you get there. You're like, how can you leave it, right? It can help you cross the river. So I need the canoe still, but unfortunately the canoe is not going to help you because now you're in the forest. And that's kind of the analogy here. It's the same skills which help you get to the startup stage and get to a successful startup company will not help you get to leading with scale. So what happens if you don't change? Actually, if you don't change, you actually destroy value. So when CVs refuse to evolve, the entire organization pays the price. So here's some examples. Your talent starts to leave. Top tier executives leave because they have no room to lead. They don't like micromanagement. They want to be independent and they don't grow, so they leave. Another example is the investor confidence erodes because they're seeing that everything is stopping at the leader and they're able to see that right away. Revenues start plateauing because the execution starts stalling because of the bottleneck, again, about the leader. And then, of course, CEO himself or herself cannot handle everything because you burn out eventually. It's just too much for you to handle on your own, which you have been doing in the past. But unfortunately, this is getting to a point where it's too complex and too complicated and too much. And the teams also stop thinking and doing because they just say, hey, the leader's going to do everything anyways. It doesn't make a difference what I think or say. Forget it. So they'll be not even adding value from that standpoint. So that's all examples of how an organization value can be changing and being destroyed as a result of CEO not scaling their skills. So what do you need to do? What needs to happen for a leader to successfully scale the MedTech company to the next level? So I'm going to talk about 5 shifts which are going to be required to be successful in that next level. Okay, so the first one is you're going to go from a fixed mindset to a growth mindset. For example, seeing failure as opportunities versus defeat. From expert to architect. Until now, you have been the expert driving things, but now you want to actually have that inform you, but not define you. It's from certainty to uncertainty. And that's a difficult one because until now, we work on data and everything has to be perfect before you move forward from a decision standpoint. And now you have to learn to move forward with incomplete data, with ambiguous data. From control to trust, giving up control so that your team can actually multiply your impact and do more than what you could do alone. And then lastly, from operator to leader. So again, not just leading by doing, but leading by mission, vision, and culture, and creating systems versus just doing more and being heroic in your efforts, right? So those are kind of the 5 shifts required to scale, and I'll just dive into each of them a little bit more. So what does it mean, fixed to growth mindset? And by the way, this is essential for all the other shifts to happen. Without this shift, you cannot make any of these other 4 shifts happen. Okay, so that's why it's like almost like you one build on the other. Without one, you cannot have 2, 3, and 4, and 5. So having a growth mindset essentially means that you're more aware about your own strengths and weaknesses. you're willing to grow and invest in your growth, and you see failures as opportunities instead of having defeat or going into negative spiral. So essentially, you start to reframe failure as an opportunity. You rebuild and don't retreat, and you get the right experts in the room to figure out how to move forward, and then you lead the culture instead of blaming and judging people and going into that witch hunt, for example, right? So as an example, a MedTech CEO grew her company to 30 million before a key FDA submission was rejected. So instead of, again, going into this spiral and negativity and unhappiness and blame, she just brought in a strategist from an external standpoint who's an expert in that area, rebuilt the team, and 14 months later received a clearance scaling to 90 million. So that's an example of how having a growth mindset can actually help you move to the next level. Because failure, they're going to happen. But how you deal with them is what's the difference going to be between a founder level and a scaling level CEO. The second shift I mentioned was being from expert to architect. Again, in the early stages, you're the expert. You maybe could be the clinician, you could be an engineer, you could be the patent holder, you could be driving everything because you were the expert. Now it's about your judgment and your ability to lead other people versus your own expertise. So as the expert trap is all about knowing the answer, creating dependency and bottlenecks because everybody comes to you for the answers, versus being a decision architect where you have a framework you have built, having clear ownership assigned to people and empowering them to make the decisions. And only having the most complex issues come to you, which cannot be resolved on their own in your teams. So expert-led companies plateau, decision architect companies compound. So again, as an example, an MD, PhD founder stopped defending decisions at board meetings, right? Because that's the usual thing is, the board hammered on him or her and just had to make a kind of creating a resistance. But as opposed to showing the system behind that information and decision and having a joint discussion and decision with the board to come up with an approach going forward, and then raising 40 million in 60 days. So that's just an example of, you don't have to be expert, but the architect now working with the board together to come up with a solution and not being based with that ego mentality of, I. It's about we together. Okay. And then shift 3 is always going to be hard, but important shift, leading through uncertainty. This is going to be more and more of a problem as you grow the business, and more decisions will have to be made with ambiguous data. So a certainty seeker mentality, you wait for perfect data all the time and you slow the company down. But instead, if you're able to act with 70% of the data and use the right judgment and the right inputs from people, you can make a decision and keep moving forward. So for example, after an FDA setback, a CEO held an all-hands meeting, laid out 3 paths with the right people, and 1 board approval in 10 days. Even though a lot of the information was still not even clear from the FDA. So that's just an example of leading through uncertainty and not being caught up in the negative drama. The 4th shift I was talking about is from control to trust. Control feels safe, but it kills scale. Empowerment multiplies judgment. So you have faster decisions, higher retention, and more engaged teams, more empowered teams. So you have to learn to delegate more, which is very hard when you're coming from the founder mentality where you have driven things yourself. And sometimes they will not do it as well as you do, okay? But that's still better than you doing everything and burning out and not allowing people to actually add value and compound your overall performance. So for example, a surgical robotics CEO delegated contracts above 500K, which initially he had to approve each of them. And that totally changed the velocity of the deals just by delegating that important. But if you have a good VP of sales, for example, that person can drive that. It doesn't have to come to him. And then the fifth shift again was from operator to leader. So again, all of these things I talked about here will lead to this outcome where instead of being involved in every deal, every hire, every decision, reviewing everything, being a bottleneck for everything because you ran the company. Now the new identity is you're an architect of culture, of systems, of strategy. You have hired a team who are independent thinkers and empowered to lead, not subordinates. And then you lead with vision and capital allocation. So an example from MedTech standpoint is you reviewed every FDA submission, every page, every line. But instead, you shift to building a regular leadership team. Timelines drop 40%, confidence surge. So the key reframe here is you build a company that runs itself. How you spend time changes, and you lead by mission, vision, and culture instead of by doing and by heroic efforts. So hopefully these are adding some clarity and some value in terms of how to make that shift. Now, how can you make these shifts happen? Well, all of these shifts start in the mind. And we have something, some of you may have attended my talk last year, but the whole idea is all of us can be led by the lower brain, our survival brain, or a higher brain. And that's going to dictate the kind of leader you are. So a lot of times we are ruled by what you call saboteurs, which are basically internal negative voices that are lies, but actually sound like truth. And they rule us in the wrong way. And they sabotage us. So here's some examples of what we call saboteurs, which are being shown in the research using neuroscience as how they derail you. The biggest one is a judge. You could be judging yourself, or you can be judging others, or you could be judging circumstances, right? So there are three ways the judge shows up, and it adds stress, anxiety, worry, and puts you in a negative spiral. And then the judge brings along what he calls accomplice saboteurs. Here's some examples. The hyperachiever. That one's all about making you look good. It's all about you and what helps you look better in terms of your constituencies. And it also looks at you as only being worthy if you perform. So everything is measured by your own output, your own performance. You love yourself only if you're doing well. Otherwise, you're just a hard judge for yourself. Another example is the controller. That's the negative voice in your head, which wants to control everything. Otherwise, all hell's going to break loose. That's again a lie, and that fuels micromanagement and quietly kills delegation and engagement. The third example is restless. This is also quite common in leaders where you just go from one to the other, pivoting constantly, changing decisions, and not going further enough until things are resolved. And so momentum pays the price. So just some examples. There are actually 9 different saboteurs. I'm just showing you 4 here. Excuse me. But these are all bringing us down from a performance standpoint, from a well-being standpoint, and from a relationship standpoint, because we are being ruled by our survival brain. Survival brain was helpful for us in the beginning when we were younger, but as you grow older, they become liabilities for us. Okay. Instead, if you're ruled by a higher brain, we call them your sage. Okay. That's the part of your brain which leads with clarity, wisdom, and real power. And that's the part you want to be leading from to be a leader at scale. And here are some of the powers we get unleashed when you're leading from your sage. Empathize power. That what creates safety, keeps great people, builds trust. Explore power. That helps makes you be curious, understand options, evaluate possibilities. Excuse me. Innovate power is all about creativity and addressing problems in unique ways. Navigate power is your big picture thinking, really able to see more strategically, mission driven, and what's most important. And then lastly, activate power, which is all about laser focused execution. Excuse me. So you can see how each of these powers can translate to incredible skills, which is going to take your leadership to a whole new level. So all these shifts are possible, but take some time and effort. Okay. Each of these, just like for physical fitness, you can't build your biceps and triceps and muscles in a weekend or a one day workshop. Same thing here. Lasting positive change takes 20% insight, but 80% mental muscle building. So the mechanism by which we are making this change is called neuroplasticity. So in our mind, excuse me, my voice is getting a little hoarse here. So we have neurons firing, and they have these synapses with multiple options available. From childhood, they have been going in a certain direction when certain events happen. So on this example, you can see maybe if we go to the left, I have the negative thoughts keep going in the same situations. But if you're able to make that signal pause and then move to the right, that's how you shift your mindset. And that's the basis of how we do it. It's called neuroplasticity. And that's the basis for how we make our identity shift. It's required to scale as a leader. Now, most of the time, the positive change fail because we stop at the insight and don't build the habits. Sustained change actually requires you to work on laying down these new pathways and making them your new pathways permanently. And that takes daily practice. So in the end, we call it mental fitness. The mental fitness is how you're able to switch from your lower brain to your higher brain. And you have a direct impact on important attributes required as a leader at scale: fundraising, team performance, growth velocity. All of these are going to shift the moment you shift as a leader. So the higher the percentage of time you're in sage mode, the higher brain, the better leader you're going to be. So essentially, in order for you to scale and make those 5 shifts, you have to be more and more in sage mode. Excuse me. Higher mental fitness basically means more time in sage, which means your new identity required to scale is in place. So we call that sage leadership. Be the sage. That's my cup here. Be the sage. Everything I talk about today, you can, in 3 words, describe that. Be the sage, everything shifts. So here's kind of the model of how this would happen, the operating system of mental fitness training. The first layer at the bottom is when you start getting more awareness about your saboteurs, the negative voices which are bringing you down. They may have worked at the founder level, they're not going to work the scale level. And then we start training you on different ways to weaken the saboteur and strengthen your sage, which is the second layer. And third layer finally is you're now trained your brain to act more and more from sage mode. The saboteurs never disappear, but they are weakened and you don't listen to them as much. And that transforms the leadership. Okay. So It's kind of a different way of showing that same model of how transformation happens. First is the disruption. You challenge the belief which was sustaining the old identity, meaning what worked before. You're challenging those behaviors and identities to say, hey, is it still going to work? Then you get to awareness, which is you're getting more aware of what's holding you back. Right now, you don't even know what's holding you back. For most of us, right? Then we get to practice to build the new leadership behavior through repetition. And finally, it's the integration phase where you actually are now doing it intentionally all the time, even under pressure. Now, most leaders get stuck between stage 2 and 3, where they're aware of what's holding them back, but they don't have a model or a way to practice and integrate to make that shift happen. So there are lots and lots of ways, and you'll hear about all these things in many different ways. Many of these, I think, are probably not new for you. But what's new is how to actually go to step 3 and 4. Okay. So we can keep talking about this, right? Or you can take action right now to become the leader your company needs to scale. You cannot grow your muscles by attending lectures, right? Or talking about it. You have to work at it. You have to do the workouts. Similarly, you need workouts for mental fitness training to get to the leadership level you need. So that's why what I want to do is introduce to you an opportunity to join a cohort, 12 seats, 2 different cohorts, 6 each, where it's a 3-month program where you can actually move from one leadership level to the next, be at scale. Basically, be 2 cohorts. You have weekly group coaching sessions. There's the peer learning going on because of each of you learning from each other. And what's unique and different here versus everything else you may have seen is the app called Positive Intelligence, which gives you direct and daily content built for busy people like you, 10, 15 minutes per day. That's all you're going to spend in the app. But that app is going to give you simple exercises, reflections, experiential coaching techniques. This is going to shift your mindset from saboteur to sage. We'll do an assessment before and after the program to see your change and growth. So all the things you'll walk away in the middle here, the new leadership identity you need, high confidence, staying calm under stress, stronger fundraising presence, strategic thinking and foresight, better decision-making, and of course, better team leadership. So if you're a MedTech founder navigating Series A to C growth, you have a growth mindset, who are the best people to work with, by the way. They are the ones who really are interested in growing and learning and taking the leadership to the next level. Or you're preparing for a major capital raise, or you're building a leadership team, or just ready to scale. This is for you. So just to give you some idea, month 1 would focus on the first layer in the bottom we talked about, identifying the patterns and disrupting the patterns that keep you stuck, understanding your baseline sage voice. Month 2 becomes activating your sage powers, weakening your saboteurs, and starting your transformational leadership. And month 3 is you start leading with clarity, purpose, and calm confidence. Your new identity shift we talked about here is starting to unravel in month 3. So the most important investment in a company is the one you make in yourself. This is one of the biggest things you need to change going forward, because as the founder, either you don't think about leadership development, or we think about, I don't know, money for this, but actually it's an investment. So the time investment in this program is going to be 3 to 4 hours per week. 3 months. That's the mental fitness work you're going to put in to make that shift of your identity. Financial investment is 1,500. I don't charge too high rates, 500 per month. It's reasonable. For leadership development programs, you'll see things that are much more expensive usually for these kind of programs. My goal is to add value right away for you versus talking about it. And the outcome, you'll be a better leader. Your company needs to scale. Again, any leader who invests in these identity shifts will become the one great people follow, elite investors back, and attractive markets reward. And if for some reason you feel that you'd rather do it alone, the one-on-one coaching, I have the program for that, or take your leadership team together, which is actually amazing. You can actually have a leadership culture called SAGE culture, which would be amazing for the company as well. So be team level, could be individual, or could be a cohort of leaders as a group. So with that, I want to leave some time for questions. Any of this content I covered?
Thank you so much. Really enjoyed that. I was taking notes all throughout, and I'm glad the thing is recorded because that's super helpful. Folks, as you have questions, throw them in the chat. I'll be grabbing those, pulling them in. I put together a few, and I'm to start with the first one that had been asked from Mike. Mike, thanks for joining us. Mike had asked about founders and CEOs getting replaced by boards. We know that happens from time to time, especially in scaling startups. And he was wondering, do you have any perspective on when that happens, how that happens, at which stage it typically occurs? I suspect maybe related to they don't make the shift.
Yes. It does happen. I've seen both situations where the leader evolves and takes it all the way, or the leader is replaced intentionally. And I've even seen a third situation where the leader herself said, you know what, it's time for me to go and have somebody else come in. So all three are possible. And the question is, what do you want to do? What do you want to be? Right? Do you want to be the person who takes it all the way? Or do you feel like, hey, I just want to focus only at the early stages. This stage is not for me. I've had those kind of people too. That's fine. But just be aware of what is your goal as a leader. The most important thing is in having a mentality of continuous growth. That because a true leader never arrives at perfect leadership. The moment you think that, you're not, right? So it's always about self-awareness and having clarity around what you want to be. But I would say all three of those situations occur and maybe the right thing to do.
That does take a really high level of self-awareness for the person themselves to say, hey, for this next phase, I'm not the right one. And to have that perspective of what they can and should do,
Yes.
and what the company can and should do. That's intense. You talked about the breaking habits, building new habits, and people getting stuck in that, like they know what the problem is and they're not taking action. Could you talk a little bit more about what some of those like old habits are that need to be broken that you commonly see? And maybe
Yes.
what's like one habit a person could start right now that could help them down this journey?
Yeah. So one of the habits I've seen in leaders who are at the early stages have been very successful bringing it to, 15, 20 million in revenue. They, in fact, I have a CEO and a CEO who work together, partners, led the company, but they have a hard time working with each other. And I was actually brought in to help both of them work together more because the CEO did not evolve his thinking and leadership to work more in partnership with people, learn to empower and empower decision making, and build a team around where each of them are capable and driving their own decisions and people. He was always with the mentality of people come to me for decisions. I want to be involved in everything. So that's probably one important thing to start with is, hey, how much do I need to be involved in everything? And how much am I really needed at these meetings? The more you empower your team members and get out of the way, the more you'll see amazing things happen. So that's just one simple habit to start with, is saying, hey, where do I really need to be, and where can I empower people to actually drive decisions and action?
Oh yeah, that makes a lot of sense. And I even think about in Avio, when I started, we were building like client proposals and then they would get signed off. We eventually realized there was actually a bottleneck to spend so much time developing them. And then a person who hadn't been involved in the process had to review it, I had to re-explain it. So we decided that for anything below a certain dollar amount could just go straight through.
Yeah.
That little simple change, right? A level of trust, delegation, architecting the system,
Yeah.
and we were able to move so much faster as an organization.
Yes.
One more question for you. What do you think? Like, we've heard this, we know these things. Like, what do you think holds people back from making that first step? They know where they want to be, they're
Yeah.
aware. What locks them in?
Well, first thing is, hey, do I really have money for this? And secondly, do I have time for this? And so the problem is they think of that as the cost versus an investment. So that's the biggest thing holding people back is, hey, I don't have time or I don't have money. And what they don't realize is actually it unlocks so much more revenue when the company performs better, that this thing is not even a decimal point of the investment they're going to actually put in there versus the value.
I think about a really simple thing of I'd studied Spanish in college and I wanted to pick it back up a few years ago. So got Duolingo. And they do a really good job of like making you feel that streak, keep up the habit.
Yeah.
And I think I'm 2 years in now, and it has dramatically improved by just every day,
Yeah.
right? Making that commitment to effort.
Yes. And
Uh,
actually, that's the third thing which hold people back is there's no solution they see to actually make that change happen. Everybody talks about what needs to happen, but how to make it happen in a structured
yeah.
way, that's the third reason people are held back. And that's why I want to offer this program to people, because it's like I'm giving you a structured way to actually make it happen, not just talk about it, right? So
Yeah, get help. Right.
it's like the
Um,
Spanish app, right? That
mhm.
for you. Without the app, it's hard. But with that
Yeah, it
app, you
holds me
actually,
accountable.
yeah, yeah.
One more question from the audience here. We got Jenny asking, how have you seen this affect the types of people who the CEO eventually hires after changing their mindset? So making that identity shift, how does it affect who the CEO hires?
So I'm sorry, I don't understand the question. Can you repeat that?
Oh, I take it as, and Jenny, correct me if this is wrong, but the CEO, when they're still in that sort of like, I have to control everything, the early mentality, they might be hiring people that have a certain background in a certain way. How does their hiring change when they've made that identity shift? Do they look for different kinds of people, different skill sets in their
Yes,
team?
absolutely. That's the biggest change. If they don't look for followers, they look for leaders to hire, right? Otherwise, you tend to look for people who are like me, who think like me, and that's not going to work. But with the bigger picture thinking, you'll actually realize, hey, I actually need to have people who are filling my gaps, not be like me, but have a different strength which fills my gap, so that together we are achieving the best possible outcome. That's just one example of a change.
Oh, that's a great example. Yeah, I can't remember who said it. Might have been Tom Peters, but the old saying of like leaders make leaders.
Yeah.
And you start building on the company, you can imagine
Yeah.
if you made the identity shift in yourself, but then didn't build out a team that were also capable of that shift, capable of being leaders, you'd
Yes.
reach some new plateau and then be stuck because the team that's working with you, they become the bottlenecks.
Correct. Yes.
Yeah.
Yeah. And the beauty of all this, I've worked with over 150 clients now. each and every one of us is capable of actually making that switch. That's the beauty. All of us inside us have that potential, that limitless potential. I worked with people who have very, very low mental fitness and they have completely transformed, or people who are in the middle and want to get a little better. But the beauty is all of us have that capability. But you just need to have the will, spend the time, and be able to actually take some action to over the course of some work to actually make that shift happen. So do you want it?
Yeah.
Are you willing to spend some time on it and go it for the long term? Because this is actually a journey which is continuous. It's not going to end at 3 months. You're not going to be there perfectly, but then we'll have an acceleration after that in the next 3 months.
Yeah, it's actually, and I'll get back to the question, but I think that's a great point that, especially in this industry, especially in startups, my observation is you have a lot of driven, outcome-driven people. And I think sometimes be a challenge for them that they want the outcome, but they're not appreciating that in this situation, it's a journey and it doesn't necessarily end. You're always improving, you're always reskilling, you're always maintaining.
Yes.
And it's not necessarily you reach a point like a skill where you can say, I have mastered this and now I can move on.
Right. You get better and better. But the beauty
Yeah.
is, even when you get better, there's a huge transformation in the performance.
Yeah.
It's huge. So that's you don't have to get to perfection. Just making a slight shift completely takes your leadership to a whole new level.
We got one more question coming from Nestor. Nestor, thanks for being here today. Asking about, you know, what do you do with team members when they can't make the shift? They may have the potential, but they're not making the shift, and you've got a business to run.
Yes. So part of that is you own that problem. You got to take part ownership there. As a leader, the inspiration and motivation of your team is your responsibility, right? So that's one aspect is you as a leader take accountability and do your best for that. And the second is, of course, after you try everything and it just is going to work, then you got to take the right decisions and say, hey, move on to somebody else. I mean, in the end, in the sage mode, you try to explore, you try to empathize, you try to navigate, but maybe you have to activate at some point and say, okay, sorry, this is just not the right fit for us, not the right thing for the company. But first try with your own accountability and make sure that you as a leader are doing the best to engage the person, not just blame the person for not doing it.
Indeed. Folks, any other questions? Throw them in the chat if you got one or two more last questions. We got a few minutes left here. I'll give it another 30 seconds or so.
Actually, Nestor has even experienced some of these shifts himself. It's been amazing to see that. So I know he's an open advocate for me, so I can share that. But Nestor, if you want to share a few words about the value of this work, that'll be helpful.
Oh, and we got a question that just came in that said, speak to the blended personal and business leader transformation that occurs simultaneously.
Yeah, so again, the beauty of this work is it's not just about work. When you make that shift, you'll actually see a relationship impact with your spouse, with your kids. You'll actually see everything change at home, not just at work. Your relationships get better, your well-being, so your stress, you're just less stressed. You're able to deal with things in a more positive way. Suddenly, things which brought you down won't bring you down. So your well-being get much better, and then of course your performance at work gets much better. So it's all three things happen together. It's not just unidimensional one side. And that's why I'm not even beginning to talk about the personal side here, but there's a huge personal growth happening beyond just the professional development.
Indeed. And great question from Randy. Randy, thanks for joining us. He asked, what are some first level leadership recommendations when doing a merger? We know a lot of startups that's an outcome they're going to have. They might get acquired and they're merging into another organization. Thoughts there?
Well, there, at least from my standpoint, it's a culture, right? So how do the two cultures fit together?
Mhm.
How do the overall mission and vision fit together? And then priorities is the third thing, right? Because a lot of times for good partnerships to work together, the priorities have to match. So if the priorities don't match, that also is going to be a problem later. So I would say culture, strategy, and priorities are the three things which would need to really important to consider as we think about mergers.
Mhm. It's a great question. Um, Folks, one more call for last questions. And while we're seeing if there's any last questions, I want to just say thank you. They're fantastic as always, very thoughtful, insightful, gives me some new things to think about, and most importantly, to take action on. Um, Folks, this has been recorded. You'll get the recording, you'll get the summary probably by tonight or tomorrow morning. If you have questions, you can reach out. We'll get you in touch with Nirav. He'll have your info. You can reach out to him. I really encourage you to check out the SAGE program. It is a low cost investment for very high return. We know this that in startup organizations, the people are kind of everything. So investing a little bit in yourself to boost your performance has such a great return financially, but also personally. So, Narev, thank you so much. I really appreciate you sharing your knowledge with us again, and we will do it again.
Yeah. Oh, it looks like Nestor was trying to talk, but he could not. So thank you, Nestor. And thank you,
Mhm.
Frank, for inviting me. I just love our partnership and I
Yeah,
look forward to many more.
right on. All right, folks, you enjoy the rest of your day, and we'll see you on the next one.
Thank you. Bye bye.